veins usually from the waist down.
Correct. But you can have veins of the groin. You can have veins of the abdomen. I've never seen any veins on the buttocks, but I have seen them on the thighs, right below the buttocks, all caused by varicose veins in the legs.
Okay.
This is a little bit graphic, but this is an interesting picture of a procedure called ambulatory phlebectomy. And that red line is actually a vein that was removed through very tiny poke marks in the skin. And the brown mark on the leg below it, on the thigh and the leg, is where that vein was on the surface. So we just laid it out so someone can see that long vein coming out. And this is a procedure that we use to remove the bulging veins on the surface, because when they're really close to the surface and they're very bulgy and tortuous, we can't laser them because you just can't feed the fiber in. So this is to remove them at the same time as the laser procedure, so you get it all done at once.
Oh, okay.
This is another treatment procedure called ultrasound guided sclerotherapy. This is a procedure which unfortunately not many people do in upstate New York, but it's very important. And what we do is, after we treat the veins under the surface with the laser, and we treat the veins on the surface by removing them, sometimes you're going to have some veins left behind. When you do have veins left behind, what you want to do is treat those veins to prevent a recurrence from veins from coming back. And what we do is we use the ultrasound, we position the needle of the syringe right in it, and we inject the medication, and that medication then seals that vein shut so that it reduces the risk of recurrences of veins coming back.
So years ago, when people had their varicose veins taken care of by being stripped and things like that, there was a reoccurrence.
There's a high risk of recurrence.
Because you were taking care of a woman. We just saw a picture of that done 20 years ago. But with the new treatments,
that risk of recurrence seems to be much less. 5% or less is our feeling, is what we're thinking. Now, this procedure has been out for about 6 years now. It's been approved by Medicare for about 4 years. So, you know, we don't have the long-term data like we do with the old stripping and ligation procedure. However, the preliminary studies look very good for long-term resolution of the varicose veins.
what would you say was it, 50% years ago? The old way?
Actually, there are some studies that said there's 50% chance of recurrence, yes.
Right. I was just guessing.
No, actually, you're right.
I was right on there. All right, one last picture here.
Here's one last picture. Here's one of our patients. This is someone who suffered from an ulcer on his inner ankle for 3 years. We treated his underlying veins, and his ulcer healed up in approximately 3 months. You can see he has a very tiny thing right in the middle of the skin, which is continuing to heal. If you don't think this guy is ecstatic, it's amazing.
How did he even wear shoes or anything?
Well, that's the problem. I mean, you know, between the oozing and the infections that he had, and this gentleman, he was a hard worker all the time, never missed any work from this, but he's very happy to have this healed up.
Excellent. All right, Doc, we need to take a break. When we come back, we'll talk about who should see a doctor, why you need to see a doctor. Also, the phone lines are open, 607-433-8815. Free advice from a doctor. Come on, give a call. We're going to take a break. We'll be right back right after this.
You're watching your hometown station, WISF. You're watching your hometown station, WISF.
Hi, welcome back to News 15. I'm Cindy Bucci, joined by Dr. Dohner from Oneonta Laser Derm. Phone lines are open if you have a question. We're talking about varicose veins this evening. 607-433-8815, 607-433-TV15, the number to call. Put you right through to the doctor. We've been looking at photos throughout the evening. Don't diagnose yourself. You need to make an appointment with Dr. Dohner. And why do they need to do that? Why do they need to see a doctor?
Well, the reason you need to see a doctor is because you don't know exactly what's happening. And you can go on the internet and people might diagnose themselves with fibromyalgia, all kinds of crazy things when your physician can help you decide what's going on. Now, a lot of people say, well, why can't my doctor just order an ultrasound at the hospital? Okay, and figure out what's happening. Why do they actually have to come and see me? The problem with ordering getting an ultrasound at the hospital is that they're geared towards making sure that you don't have a deadly blood clot in your deep system called the femoral vein. And if your doctor sends you for an ultrasound to look at the veins on the surface, the report's going to come back, no DVT, no obstruction. Well, that's wonderful, and that's important to know in some cases. Unfortunately, it's not helpful at all in terms of varicose veins.
There's no treatment being offered.
There's no treatment being offered. There's no true diagnosis as to what's happening under the surface of the skin. Okay, so when you come to my office and we do an ultrasound, I'll interview you, I will examine your legs, I will also personally do your ultrasound, so I know exactly what's happening, and I can give you, as a patient, an idea of what's happening and what your treatment options are. Okay, so a lot of people will come into the office and they might have a few spider veins, and they might have some very tiny veins on the surface that are having a little bit of backflow, but they're not actually causing a problem. And so you need somebody who has treated a lot of varicose veins to help you decide, are the veins that you have actually in need of being treated, or are they just not very significant at all?
So you could have some veins that look like the really bulging varicose veins.
Yeah.
But if you're not in pain, no rash, no weepiness, no nothing, you would leave that alone?
Most likely. If they didn't have any symptoms that we talked about, pain, aching, swelling, nighttime leg cramps, restless leg syndrome, daytime leg cramps, or diabetic peripheral neuropathy, or they didn't have any rashes on the legs, they didn't have any thickening of the skin, they didn't have any ulcerations, there's really no good reason to treat those. Okay, it's like somebody who has a crooked nose but they can breathe fine. Why treat the nose?
Got you. So you wouldn't cosmetically just fix that just for cosmetic reasons?
Well, you can.
You can?
Oh, you certainly can. Your insurance is not very likely to cover that. Okay. But if you had bulgy veins like that first photo that we showed at the beginning of the show, it's very unlikely that you're not going to have some problems.
Exactly. How could that not be painful?
Exactly.
Now, they need to go and see you, because you can't just try and diagnose yourself from the photos that we've had on, because frankly, half of those photos look like someone with diabetes that has a wound that doesn't heal.
Right.
And that's not the case.
It can just look like a little rash that won't go away. Some people think they just have eczema.
I was going to say
Some people think
eczema.
they have psoriasis. I hear that all the time. Or I thought it was a fungal infection. Here, of course, is that example of that big bulgy vein. This was a man who was a runner and a teacher, and he had quite a bit of symptoms.
Now listen, after you fix this, Doc, how does it look after? Is it smooth again, or?
Yeah, it's almost always smooth. Sometimes if you have some brownish discoloration on the skin, that brownish discoloration will not go away.
Right, but as far as that bulging vein, it smooths right down?
It smooths out.
There's no bulges there at all after that?
Right, and the little nicks that we put in the skin to remove those kinds of veins are about 2 millimeters, which is the size of a freckle. So the days of having to leave those really big, long incisions on the leg from the old stripping procedure are just gone. You don't have to do that anymore.
Now, I know you said only about 10% of your clients right now for varicose veins are men. I bet you do get a lot of men in there. They don't wait around for this, because I can't imagine them wearing the compression hose and all that. That's just not a thing that men would want to do.
Unfortunately, like in everything, women are much more likely to be aware of their bodies and want to take care of themselves. And 30% of women do have varicose veins.
So 40%